Hi, I'm Jenny Backus, Acting Assistant Secretary for Public Affairs here at HHS. And welcome to our 9th web chat on the Affordable Care Act. We bring you these web chats because we know that sometimes the details of the Affordable Care Act and the new law can be confusing. There's also been a lot of misinformation out there, so we're here to answer your questions. We've talked a lot about many different aspects of the bill, but today we're going to talk about specifically how the Affordable Care Act impacts Medicare beneficiaries. This is a topic we've gotten a lot of questions about, and there's no two better people to help me answer it than our two guests in the studio today. Marilyn Tavner, who is the Principal Deputy Administrator of the Centers for Medicare and Medicaid Services, was also called CMS, which many of you guys call Medicare, and the Chief of Staff for CMS, Kaya Lewis. So thank you both. We're going to have a good show today. We've asked actually all of you to submit your own questions, and if you actually want to submit a question right now during our chat, you can send us a tweet via Twitter, and our handle is at HHSGOV. That's at HHSGOV, or you can always email us, and the address to email us to get a question on the show today is healthreform@hhs.gov. If you could, keep your questions brief because we may have to paraphrase them if they're longer, and we really want to try to get your specific question asked. And if we don't get to your question today, check out our website, healthreform.gov, and you might find your answer there because we're trying to answer frequently asked questions every day, or you can use your trusted Medicare resources and call 1-800-MEDICARE, and we'll talk more about that in a second. But Marilyn, let's start with you. This is a topic that we've gotten a lot of questions about. What happens to your Medicare benefits under the Affordable Care Act?
It's a great question, Jenny. Many people are concerned with all the information that's out there that some of the guaranteed benefits to Medicare have changed. And I just want to assure everyone they've not. Your guaranteed benefits are the same. There's some improvements with the bill, such as increased preventive care, some protections in the Medicare Advantage programs for those of you who are not in original Medicare but may be in a Medicare Advantage program. But the main point is your original Medicare and your guaranteed benefits have not changed.
Well, let's do, I think hopefully we have a lot of people who are on Medicare who are watching, but there might be people who aren't. Can we just have a quick term definition? Original Medicare, Medicare Advantage, what's the difference?
Okay. Original Medicare is actually the program that originated some 40-some years ago is your traditional fee-for-service Medicare where you can pick your physician, pick where you want to go in terms of hospital care or other care. The Medicare Advantage program is more of a managed care concept, but has been popular in many parts of the country where you're actually working through an insurance company and you may have additional benefits or different benefits that suit your lifestyle.
So there's above and beyond the benefits that original
That's
Medicare.
correct.
But your Medicare benefits don't change.
Do not change.
But Medicare Advantage benefits could change if plans change?
Yes, they could change, and they usually do change each year. And if for those of you who are already on Medicare, you know you get a handbook every fall. And for those of you who are new to Medicare, you'll be receiving your handbook for the first time. And it helps you make those choices between original Medicare and Medicare Advantage. Shows you the programs or plans that are available in your area, how much they cost, what they offer. It's really a great resource, so you should look for that in the fall.
So that's an enrollment process, and the options are different every year.
That's right.
Okay, I just want to make sure that we all understand that. Kaya, Medicare recently, and probably as we speak, is mailing out a brochure to people to explain Medicare, and sort of like what we're trying to do in this web chat today, probably even more concisely. And I have it right here, and I think you guys can see it up on the screen. Why are you doing this? What's the purpose of it? What should seniors be looking for, and other Medicare recipients?
Well, as you both just said, Medicare sends out regular information to beneficiaries and is seen as a trusted source of information on Medicare to beneficiaries. We've been getting lots of questions in our call centers about the new law, about if things are going to change. And we also know that our beneficiaries have been targeted for fraud and scams. And so we wanted to communicate clearly to our beneficiaries about what the new law will do. Let them know that their benefits won't change, that they shouldn't turn over any of their personal information to anyone that's not a trusted source. And this is something that we do when we have big changes in the law. In addition to our mailing in the fall, we've done that before with the Medicare Modernization Act, send supplemental mailings to let beneficiaries know exactly what's happening, what to expect, what's staying the same, and what's improving.
So inside this brochure, you go through some of the different benefits that are available to people. Do either of you want to throw out, you sort of mentioned them quickly, in addition, so your guaranteed benefits stay the same.
That's right.
But other things other more benefits are layered on top. Can you give me a couple of examples?
Yeah, so one good example is now annual physicals will be included, so things like colonoscopy, mammography. Initially, Medicare had an initial enrollment screening, but now this improves to an annual screening. I think another issue is for those of you who are in the donut hole, or what's called the prescription drug donut hole. There's improvements in terms of a one-time immediate $250 check, tax-free check when you reach that donut hole, but also some long-term improvements that work to close the donut hole. So those are just a couple of examples.
Anything else, Kai, or you want to just go to viewer questions? We might get some more questions.
I think I just want to emphasize that in addition to the annual wellness visit, there also will be free preventive services, as Marilyn mentioned, like colonoscopies and mammographies that beneficiaries can see happen next year.
So mammographies were covered before, but like once every 2 years or something like that, and now it's the amount of times you can get covered is changing?
Yes, you will be able to be covered as you were before, but now the cost sharing will go away. So instead of having to pay your piece for mammography, you'll be able to get that screening along with others that are appropriate for you at no cost.
Oh, wow.
Yeah.
Okay. Probably should read this brochure. All right, let's go to viewer questions, because like I said, Medicare and questions about Medicare have been, since I've been doing 9 of these, like our top topic. The first question comes from Angela. You mentioned this quickly. $250 rebate check. She says, how is $250 going to help if I'm retired and not making any money?
That's a good question, Angela. And I think obviously the $250 is immediate tax-free relief that you'll be receiving sometime this year, basically as you reach the donut hole, if you will. But more importantly, long-term, what this law includes is a closure of that gap. Right now, for those of you who experience the donut hole, you're paying a 25% of your premium or your drug cost up until around $2,500. Then you are fully responsible for cost until close to $5,000. What we're trying to do is close that gap, and that happens between now and 2020 each year. Starting next year, there'll be a 50% discount on brand name prescriptions, which you'll see when you have your prescription filled, so that will be immediate relief beginning in 2011. Okay.
Well, Jason wants to know, how is this whole rebate check process going to work? You talked a little bit about being worried about fraud. I think that's probably a legitimate, when people are supposed to get money in the mail, that's usually when we see scams. We've seen it in the past. How is it going to work? Jason says, can you tell us exactly how the $250 donut hole rebate program is going to work?
Sure. So the checks are going to be mailed and expected to be in people's mailboxes that hit the donut hole by mid-June. We'll send the checks. You don't need to apply for the checks. We'll be sending them out on a rolling basis. So as people hit the donut hole, they will begin to see those checks coming. And basically that'll happen throughout the year. So you don't need to sign up. You don't need to turn your information over to anyone. These checks will come.
But you only get it once, right?
You get a one-time $250 tax-free check, and it'll happen as you hit the donut hole. And so some people may have hit it already, some people will hit it later in the year, and the checks will come then. And there's information about the $250 check that will be up on Medicare.gov to give a little bit more details so people understand exactly how the checks are coming.
I want to jump to a question from Sissy from Alabama. Will the $250 rebate beneficiaries receive, if they fall into the coverage gap in 2010, be subject to taxes? How will they account for the receipt of this rebate on 2010 tax forms, even if it's not taxable? I think that guidance, some of that will be on Treasury, but you just said it was tax-free. Right. I just want to make sure that we're answering that part of the question.
That's right. It's tax-free, and you will not have to report it as income.
Okay. And more information about that is on your website, too.
Exactly.
Okay. Let's go, and I'm just going to see if we have any more donut hole check questions. Now we have a couple more questions on regular Medicare, and then we just got a couple in from viewers, too. Michael wants to know, what does this bill mean for in-home services funded by Medicaid and Medicare? Marilyn?
Michael, that's a great question as well. This is, at the state level, is traditionally called the money follows the person grants, and they're actually in the law is increased funding, I think to the tune of about $450 million a year between now and 2014, so more funding in that area. The second thing is more flexibility around the funding. These grants are designed to help people who are living in an institution who want to return to the community. Before there was a 6-month, you had to be in an institution 6 months. That's now dropped to 3 months. There's more flexibility around state waivers and support, so a lot of good information in there. And we will be putting that out over the next few weeks and some guidance.
So those money follows the person's grants are 2010 benefits?
Yeah, well, they actually start, they exist today. They increase in funding in 2011 through 2014. So more funding, so more opportunity.
Okay, so stay tuned on that one. Antonia, I am under 65, and I've just been approved for Social Security disability. Normally, Medicare would kick in after 24 months. Will the Affordable Care Act change this?
The Affordable Care Act does not change that. There is still the waiting period, but one thing that is in the Affordable Care Act that could be helpful to you is the issue of if you're unable to get insurance now because you are what's considered a high risk or pre-existing condition is keeping you from getting insurance. There are high-risk pools that will be available at the state level and at the federal level if your state does not participate. There will be guidance out on that in the next few weeks, but that is a benefit that will begin later this year and can offer you some relief until you could qualify for other. Also, it's important to know in this act, in this law, over the next several years, we're really closing this problem, meaning that there will be other ways for folks to access insurance. Pre-existing will go away.
Pre-existing conditions.
Right.
So, yep.
Right. So your ability to get insurance and to have some support if you're low income will be there over a period of time. We'd like to do it all today, but this is a big law, and it has a long lead time, and so there's some immediate help for you, and then long term, hopefully this will not be an issue.
So stay tuned. Some of the Medicare stuff you're talking about can be found on Medicare.gov, or if you want to call, if you're a phone person, 1-800-MEDICARE. Some of the stuff that you're talking about with the high-risk pools we've talked about in earlier web chats, so go back and take a look at our earlier shows. And our Office of Consumer Information and Insurance Oversight will be working on those high-risk pools, and I think the deadline is actually later this summer, so there'll be more information. And we'll be probably back at you with another web chat. Two questions about supplemental plans and Medigap. Ramon wants to know, after the new health reform takes effect, can I keep my original Medicare? Will I have the option to buy a supplementary plan to cover what Medicare doesn't cover?
Yes, you may keep your original Medicare, and yes, the Medigap plans will still exist, and you'll be able to buy coverage through those. So that part has not changed, so you can still do that. Now, you may be in an area where you want to look at a Medicare Advantage plan, the managed care plan we talked about earlier, because that may benefit you more or work more to your needs, but whether you want original Medicare or Medicare Advantage, they'll both still be available.
And the decision time, again, just sorry to do this sort of info commercial here, but the decision time for every year Medicare recipients get a chance to reshuffle the deck. They can keep what they're going with, take a new plan, and that's when
That's in the fall,
yeah.
in the early fall. And that's the open enrollment time, and that's when people will be getting their Medicare and You mailing that they get every year.
That's that big giant book.
Exactly.
But probably also now available on websites too, if you want to save a few trees. Elise from Virginia, and then I just want to quickly do a rapid fire round with some of the questions that just have come in, but Elise had asked, will Medigap insurance be open to a person who has Part A but not Part B Medicare?
Unfortunately, that part is not changed. So you must have Medicare Part A and Part B to qualify for a Medigap policy.
But there might be some of these new benefits that are coming, or there might be another plan that might help you.
That's right. And that's where I'll remind you we have the 1-800-MEDICARE number, and any of your personal questions can be answered there. And we actually have specialists to work with you and your needs. So by all means, make that phone call if that could be helpful to you.
And actually, I think your website also has a new function. I was looking at it the other day because my mom is actually approaching Medicare. And there's a My Medicare section where you can do some personalized stuff on the websites as well. So that's another option if folks are looking at it. All right, rapid fire round. Some questions have just come in, hot off the presses. Chris wants to know, how does Medicare know that I've reached the donut hole if I use a private insurance company for my Part D plan?
That's a very good question, Chris, but actually those private insurance companies report this information to Medicare. It's a contract between the insurance company and Medicare. They work closely together. It's a process that we are able to track that.
And I think I remember reading in one of the brochures that you talked about, it may be that there might be a couple of days of a lag between when you look at your bills and know you've reached the gap and when your insurance company reports back to Medicare. And I know you guys are working on it, but is that accurate? People should be aware it won't be a 24-hour instantaneous thing, and it'll be a couple of days, right?
That's right. And if you think you've hit the donut hole and you didn't get your check, you should check in. You can call your plan, or you can call 1-800-MEDICARE. To check in and make sure that your information is updated with Social Security Administration as well, so that if you hit that gap and are eligible, we can get you the check.
Great. Okay. Michael says, where would you tell seniors to go for additional information besides the CMS website or Medicare.gov?
Those are two very good sources. We also have regional offices around the country, and we also work with many, many partners. And so our Administration on Aging we work with to get information out, and other partner organizations that may be in their community. We emailed our mailer, the brochure, to thousands of different partners around the country. And so that information is with a lot of people that people normally go to get information, and so they should check out those resources in their communities.
And you're doing outreach to doctors and nurses too, so community health centers, so everybody sort of, if you can find this information in more than one place.
That's right.
And also don't forget the 1-800-MEDICARE, which is the world's best phone number, because I can
And on the
remember.
website, when you go to Medicare.gov, you look under what's new, and there will be copies in English and Spanish of the mailing that we sent out to all beneficiaries on Monday.
That sounds great. One last question. Do you anticipate that Medicare Advantage plans will become obsolete due to changes coming in health reform?
Well, that is a good question as well. We hear that. We've heard that for several years. I think the concern is over the payment levels to the Medicare Advantage programs, which have been much higher than original Medicare, so they are being brought down to a more consistent level. But they were last year. This year they are flat as well, and so far we're seeing robust interest from the Medicare Advantage programs. So
if you like Medicare Advantage, it's fine too. The specifics of your plan could change, but the program is
That's right.
Is there. Okay.
That's
well,
right.
Great. We're almost out of time. Just any other parting thoughts or messages you want to give to seniors?
Just feel free to contact us. That's what we're here for, to be a support. And the 1-800-MEDICARE number, the website, are your local partners.
And it's not just seniors, too. I should correct myself. Medicare also covers non-seniors.
That's right.
If you're on Medicare, or if you are helping someone who might be on Medicare soon, use these resources. Kaya, anything else?
I would just say look at those resources for accurate information, and remember not to turn over any of your personal information unless it's to a trusted source. For what we have, with benefits we have, there's no extra information that we need.
So you don't have to give anybody anything to get your rebate check and protect your number.
That's right.
Okay, great. Well, I want to thank you all for joining us, and I really want to thank our two guests, Marilyn Tavner, who's the Principal Deputy Administrator of CMS, Medicare, and others, and other things, and Kaya Lewis, the Chief of Staff. We really want to thank you all for joining us. We had lots of great questions, lots of stuff that came in. We're going to continue to work to answer your questions. And one good thing that we can ask you to do Pass this show along to other people. Tell people to watch it, get their questions answered. It's alive forever, unfortunately for some of us, on the World Wide Web, and it's available on demand on health reform. There'll be links to it up. We'll link it over to CMS too. We hope you look at the site, get all the latest information. Remember, ask questions, and make sure you go to Medicare, your trusted source. I'm Jenny Backus, and we'll be back next week with another web chat. Thanks a lot, and hope to see you soon.